By the second year of your residency, you should start preparing to perform a pan-retinal photocoagulation. Here are some tips to help you prepare in advance so that on the big day, your first procedure turns out into a flawless performance. Be thorough with the theory of indications of PRP and details including procedure and complications. Watch closely a faculty or senior perform a couple of procedures in order to familiarize yourself with the routine and order of operations with respect to setting up the machine and patient. You could assist with obtaining written informed consent at this stage. Practice slit-lamp indirect ophthalmoscopy with a plus 90D or plus 78D in order to familiarize yourself with an inverted view of the fundus and orientation. Then, practice examining patients with a laser lens such as a Mainster PRP lens, the pan fundoscope, or whatever lens is routinely used in your institution. This will give you practice in seamless insertion and removal and give you exposure in dealing with difficulties associated with it, such as patient cooperation, reflexes, dealing with air bubbles, and also gives practice in keeping necessary paraphernalia ready, such as topical anesthetic, coupling medium, gauze, and elbow rests. You should also practice good posture with straight neck and spine positioning till it becomes second nature to you. It is always best to practice on a simulator. However, if you do not have access to one, practice shots through a laser lens on a printout of a retina pasted on a cardboard. This may not be ideal with respect to curvature of the retina, etc., but will give you practice in staying away from blood vessels, optic disc, and macula. It will also help with the inverted image orientation. This will give you practice in setting up of laser parameters so that when you do it for the first time in front of the patient, your movements will be fluidic and you do not appear diffident. Keep practicing till you are able to comfortably go through all steps of machine setup and you are able to deliver spots consistently at half a burn width apart without fumbling. This next step is optional but very useful to follow. In a couple of cases to be performed by your seniors, insert the laser lens and give a couple of shots in the periphery to make sure that you are able to achieve this in a real patient and not just in a paper one. A couple of shots in the periphery in a couple of patients will give you confidence. You can practice focusing, reflex avoidance, etc. Once you have mastered what we have discussed so far, you are ready to perform the procedure on your own. For the first few cases, avoid complicated ones and select simple cases with good medium clarity. First, review the chart and confirm the eye to be lasered and confirm this with the patient as well. This is for the safety of the patient as well as yourself. Obtain written informed consent, explain the risks, and clear any doubts the patient may have. Also, instruct the patient with regard to what to expect, the approximate time that it will take, etc. Ensure adequate pupillary dilatation and give appropriate instructions where necessary for the same. Check laser settings and locate the laser lens, topical anesthetic tissues, elbow rest prior to bringing the patient into the room, and optimize ergonomics for you and the patient. Instill the anesthetic drops, communicate and comfort the patient. Secure the head straps of the slit lamp to prevent posterior movement of the patient during the procedure. Encourage the patient to keep both eyes open to increase comfort with the laser lens. You may optionally darken the room for better visualization of the laser beam. A fixation target may be used for fixation of the other eye, and it should be illuminated if the room is darkened. Ensure that all of those assisting in the room wear appropriate laser protection goggles. Test laser spots outside the arcade, preferably in the periphery, with a spot size of 200 to 500 microns, a duration of 100 milliseconds, and a power of about 200 milliwatts to obtain gray-white burns. The power may be titrated in 50 milliwatt steps if adequate burns are not obtained. In general, smaller spot sizes are preferable posteriorly and larger sizes may be used in the periphery. Regardless of the laser type or power, the goal is to achieve an adequate blanching with medium gray spots. Intense white spots like this give us a lot of satisfaction but must be avoided at all costs as they can induce hemorrhage and become foci for retinal breaks or choroidal neovascularization. always start inferiorly. This appears superiorly because of the inverted view in order to avoid an obstacle to inferior PRP in the event of a future vitreous hemorrhage. Once you are comfortable aiming shots and getting them where you want them, you can move more posteriorly. I would advise in the beginning to have your guide outline the innermost border with 1 or 2 rows of shots so that you can remain peripheral to them. This will give you more confidence to proceed with respect to staying out of the arcades. For the first few cases, use a single burst mode and not a multiple burst one. Multiple bursts can be done after you are confident with maneuvering quickly and with ease. Make sure that at all times you know where the fovea is and keep asking the patient at regular intervals if he or she is comfortable. The most posterior limit of the burn should be outlining the arcade superiorly and inferiorly, nasally 1 to 2 disc diameters away from the disc, and temporally 3000 microns or 2 to 3 disc diameters away from the fovea. Laser treatment should not be applied over major retinal vessels, pre-retinal hemorrhages, or darkly pigmented chorioretinal scars. A total of 1600 to 3000 burns are placed in 2 or more sittings. Avoid the 3 and 9 o'clock meridians to avoid the ciliary nerves and therefore pain. Sparing the horizontal meridians, that is the path of the long ciliary vessels and nerves, also protects accommodation, pupillary function, and corneal innervation. So that's it for today.
If you like what you saw, subscribe to my channel and hit the bell icon to never miss an update from AP's Ophthalmology Pulse. You may watch my other videos by clicking on the thumbnails. Please leave a note in the comment section if you wish for any particular topic to be covered in future. Look forward to regular updates. Thank you for watching.